Chloe, please explain how you should appropriately fit a bra.
Sure. So bras are often worn a bit too loose, small, tight. It's over 80% of women are in the wrong bra size. So at Allure, we always recommend coming in about annually and getting your bras refit and re-upping your collection. It's really important to have a nice rotation of bras. That way you're not wearing one out completely within about a month or two. So bras should be worn nice and snug across the back. The band is probably the most important part of the fitting. So you never want a bra that's creeping up the back like this. That means it's too loose on you. So if your bras are like kind of up in your shoulder blades, that's not what we want. We want this nice and low and flat, snug, and feeling a bit firm, especially on day one, because they do stretch out. We always say parallel to the ground, and pulling out just about an inch only is where you want your tension to be on day one. So that's a super important part of it. The wire frame should sit flush on your sternum and go all the way around your breast tissue, containing a lot of your side tissue as well. A lot of women are in a too small of wire that then cuts in on their breast tissue, and so that they then discount wires. They think, oh, wires are so uncomfortable, I don't want a wired bra, but it's probably just the wrong size wire. So those are the two really important fit components that we look for as fitters, just making sure it's snug enough, and then that cup frame is wide enough for your breast tissue.
Wonderful. Would you be able to show us how you measure for a bra?
Sure. So when you're here at a fitting, we stand behind you and we take a couple measurements over the bra you're wearing. You never have to get fully undressed with us. But I always take a measurement right under the wires, really close to where right where your breast begins, on your sternum, and then straight across, really snug for the band. So for example, this mannequin is kind of slipping down.
Here, I'll give you a hand
in real life.
That.
So this mannequin is measuring really snug at 28 inches. So I would probably put her in a 30 band. We always go up to that next bra size band, that next even number. Then I would go over the cups gently. We don't want to kind of crush in on breast tissue. We want this to be a really gentle, across the fullest part of the bust. And that's a 36. So then we would quick calculate, an estimated bra size for you. We bring it in, we try it on, and we adjust you and kind of teach you where those wires should be sitting, how to adjust your straps, and we go from there.
Wonderful. Chloe, I was noticing that you have bras from multiple different manufacturers here, which is so fabulous. Can you talk about how that is important with bra fit?
Yes, absolutely. So we have many different vendors and carry over 150 sizes. So we're not like your typical store that they're the manufacturer and they're only pigeonholed into what they produce to fit you in. We can fit you into something so customized to your body because we carry that array of brands. It's really helpful. So anywhere from a 28 band to a 54 band, A cup to an O cup, we can really customize what you need exactly for your body.
It is so great to see a store recognizing that women come in more than just one size.
Yes, absolutely. And depth and width. And it's one thing to be a certain size, but your breast shape matters too.
Chloe, I found that you have this really interesting pamphlet on the care of your bra. Could you talk about that a little bit?
Absolutely. So we want to make sure to always rotate your bra collection. Never wearing the same bra 2 days in a row is really important. And I feel like when we tell people that, I see wide eyes and they go, oh, okay. Like they've totally been doing that. And everyone does. You don't have a lot of bras that you love, so you just wear your favorite on repeat. But what that does is really stretch it out over time. Think of it as like a rubber band on your body heat all day. It's just going to stretch. And then if you don't give it that day of rest to bounce back, those elastics just keep stretching out. So we want to never wear them 2 days in a row, like I said, and washing them every 2 to 3 wears. So that's an important part too, is washing them with a gentle detergent, either in a mesh bag on the gentle cycle in your machine, and then never the dryer, or hand washing them. And same thing, never want to put them in the dryer. I always recommend hanging them by the center over a drying rack or just laying them flat. If you hang them by the strap, over time the water weight of your cups drying can stretch out a strap.
That would be horrible.
Yeah, no, and then you feel lopsided.
Chloe, can you talk about how the cup size volume changes with the differing band sizes?
Yes, and that's Such an interesting concept to kind of wrap your head around. A lot of people think I'm a D cup, but a D changes from one band to another. So a 30 band, which is pretty petite, that D cup is a lot different in volume than a 40 D cup. So here I have two examples. This is a 36F or triple D and a 32H. That would be 5 Ds. So showing that those are the same cup volume, but on two very different band sizes. So we can see I have the 36 underneath the 32. So what a lot of women are doing is they're wearing a bra like the 36F, too big around their bodies in order to get the amount of volume they need to cover their breast. But in reality, their rib cage is more petite. They probably need a tighter fit here to give more support, and then a larger cup to cover the volume that they need. So that's a lot of what we see here. Women coming in wearing the 36F needing the 32H, or wearing a 40D needing like a 34, G or something. Just a different inequivalency in going tighter here and wider here to get the proportion you need.
And I see that you have many, many different brands of bras,
Yes.
which is very nice because we are different and we need different fittings.
Yes.
Now, we have a lot of people now who are either getting bariatric surgery or they're losing weight
Yep.
with diet, with exercise, with medications. As your weight changes, your breast changes.
Yes.
So how do you recommend our patients with weight loss handle bra fitting?
Again, coming in frequently. We recommend people coming in about once a year is really important, or after a big body change like weight loss, weight gain, pregnancy, whatever it may be. Because our hormones, our weight fluctuates, the bras stretch out. It's really important just to come in frequently and get your bras checked. Sometimes women will find with a big weight loss that they have looser tissue because they've lost that volume and their skin feels a little bit more maybe stretched or sort of saggy, and we just accommodate that with a different style of bra. Maybe something that's a little more full coverage to really smooth everything out, especially a wider band to affect, the smoothing on the sides.
And I have heard that it is actually possible to fit a bra and adjust a bra for the patient.
Yes, absolutely. We want to make sure that you are within the cups. We often ask you to kind of center your tissue. We teach you how to adjust yourself every day into a bra. There's one thing about putting it on, but then putting yourself into it properly that really makes a difference.
Wonderful. Chloe, tell me, what do you do for a patient who has breasts that are of different sizes?
We see that a lot. Everyone differs a little bit to a lot of it. It's our bodies. That's totally normal. What we always do is fit the fuller side. So we want to make sure your fuller breast is not feeling pinched or punctured on the side. It's not spilling out. So we're going to fit that side properly. And if you have a little bit of openness or gapping in the slighter side, that's fine. We'd rather that. If you have a pretty big difference, we have inserts that we sell to kind of fill in that slighter side if you want. But mostly, you don't notice it as long as that one fuller side is fitting properly.
Wonderful.